Hi to all of you. Welcome back to the channel, and in this video, which is a bioconcept video, we'll be discussing the concept of biomarkers, what they are. We'll be giving the introduction, then discussing their characteristics and how they are used in the biochemical testing. So what are biomarkers? Biomarkers are the characteristics which can be metabolite, biomolecule, anything which can be measured and evaluated for the indication of three things within the individual in which it is measured. Either it can measure the normal biological process, it can measure the pathogenic process, or the pharmacological response to certain drugs, so certain therapeutic interventions. Nowadays, the biomarkers are chosen in such a way so that they will be able to measure all three. Uh, Essentially, a biomarker should be able to measure and quantify the biological parameters which it is measured, and then it can serve as the index of health for the related assessment as well. So essentially, when biomarkers are used for the detection of certain kinds of disease, they should have certain sentinel principles in them. They should be able to detect the disease, and they should be able to tell us the information about the stage of the disease, predict the response of a treatment if treatment is given. It should be also able to determine treatment efficacy, monitor the treatment compliance, as well as monitor progression and recurrence of the disease. These are the sentinel principles for some biomarkers which are used for the disease specificity. Essentially, when a biomarkers are chosen, they are chosen based upon certain characteristics which should be inherent to them. There are so many characteristics which a biomarker should possess, but four of them are important in choosing them for the diagnostic purposes. First and foremost is it should be specific. The biomarkers which are chosen should be specific to a specific disease. In turns, it also mentions that it should not be able to detect something which is not related to a disease. That is, it should not be giving us false positive results. Then it should be sensitive enough to pick up a smallest change. It should be precise in diagnosing that earlier cases of the disease as well as detect the minor damage. So it is reflected in no false negative thing also. So it should be sensitive enough so that it will pick up the change and tell you that it is disease condition. Then there is prognostic feature. The biomarker should be directly related to the disease. Its levels in the serum, if you are measuring it in the serum, then its levels, its strength should be equal to that of the extent of the disease. Greater the disease, greater should be the value of a biomarker in the plasma, and hence its prognosis. Then it should be able to persist long within the individual so that we can be able to pick up it from the blood or any other fluid and then analyze it for the diagnosis. And it is important for the delayed admission also. If there is a delayed admission of the individual and we need to look for the biomarkers, those biomarkers are chosen which persist around 1 day to 2 day or 3 day, which makes it a good biomarker. In order to further discuss the difference between the sensitivity and specificity based upon the patients, then we can say the sensitivity of any kind of a biomarker for a patient care is the proportion of the patients with the disease which a biomarker will identify as the correct patient. So it tests it as a positive, and the specificity will be the proportion of the patients which are without the disease who will test negative for this kind of a biomarker. So in terms of the statistical outcome, the sensitivity for a particular biomarker should be true positive. So a biomarker is called as true positive when it is able to identify a diseased patient among the given number of patients, and then it will be measured as the proportion of all those patients which it correctly identified as the diseased ones, and the specificity will be true negative when it will be able to detect the non-diseased conditions out of all the total patients which are measured for it. Furthermore, in order to be used for the biochemical testings in case of many kinds of diseases which are there in the clinical scenarios, number of other characteristics are also taken care of, specifically in the clinical laboratory where the specific biomarkers are used in the biochemical testing. These characteristics are the prime one is the precision. Precision measures the reproducibility of the analytical method. So the biomarker which is being used should be able to give the similar kinds of tests on reproducing it for the same sample, whereas the accuracy measures how accurate it is to the actual value, how close it is to the actual value. As you can see the two different concepts in the associated diagram. The precision measures the reproducibility. Every time you will test this sample, you will have a similar kind of result which will fall close to each other, whereas accuracy measures how close it is to the actual value. So if precision and accuracy are correct, then the biomarkers or the biochemical test can be used for the diagnosis and detection methods as well. Then there is a reliability. Procedure is based on evidence principle or not. There is a association between the procedure which we do for the biochemical testings. In case of here biomarkers, the biomarker is based on evidence principle as well. Then other things are the simple and inexpensivity, which is prime in choosing a biomarker for the detection method. So it should be usually easy to perform. It should be easy to perform anywhere. Also, it should not be dependent on too much of infrastructure. It should not require too much of manpower, and no need of highly qualified personnel also. Then the turnout time, it should be able to give the results within a specific 1 day or 24-hour time. So if it is quick, then the biomarker is good. A wide variety of biomarkers are available, but they are seldom used lonely for the detection of diseases and to monitor them. What is in turn done is that number of biomarkers are chosen in a way to form a panel, and they are being tested biochemically in order to assess the state of well-being. So biochemical testing involves the number of different kinds of biomarkers taken together and measured for the assessment of a state of well-being of an individual, and they give the results in a definite measurable parameters. So measurement of biomarkers, metabolites, molecules, which are all biomarkers, can be done from either body fluids or directly from the tissues. And they are collected, as we already know, for the purpose of diagnosis and treatment and prevention of disease, and for also greater understanding of the processes of the diseases. So all these substances, metabolites and molecules are actually what? Biomarkers. So biochemical testing is the measurement of these biomarkers for the diagnosis, treatment, understanding of the disease process. Usually biochemical testings are interpreted in light of the quoted reference range. We have a reference range for each kind of a biomarker or each kind of a biochemical test or each kind of a metabolite, and against this reference interval we measure the biomarker. Usually this reference range is set for 95% of the apparently healthy people. So usually the ranges fall within the 95% of the healthy people fall within these ranges, which are set as a reference range. What we do the biochemical testing for, or what we do the measurement of biomarkers for, are usually the blood, urine, feces, or any other kinds of tissue fluids. And the parameters which we measure in biochemical testing are the usually two different types. Either the concentration we measure at a particular time and location, or we measure the type of a biomarker at a particular time and location. Most commonly, the parameters which we do in biochemistry lab are the parameters which belong to either glucose, or we measure the electrolytes, we measure hormones, we measure metabolites of carbohydrates, lipids, proteins, as well as some minerals and vitamins we can measure under the flag of biochemical testing. And why we do so? We do so in order to diagnose and manage the patient. For example, like say we are diagnosing and managing diabetes, renal failure, heart attack, drug analysis, or hepatitis. Concept video covered all essentials of the biomarkers and the biochemical testing which we do for the diagnosis and the monitoring of the diseases. If you like the video, go through my books on Amazon. They are available both in Kindle and paperback format. And do subscribe to my channel for further videos which I will upload in due time.